When it comes to healthcare, Kimberly Green doesn't get it. I don't think for a minute she doesn't know anything about sickness. She's had breast cancer for more than 3 years. She's had highs and lows, but she knows that wellness can only last for so long when you have stage 4 cancer. Green, like much of the country, could be one health crisis away from financial ruin. What she doesn't get is why so many people don't understand. Her treatments cost $6,000 a month. Without it, she could die. Green shakes her head when she thinks about it. Tens of millions of people without health insurance, all lacking what she's got that's kept her alive. Now, as the nation debates how to finally deliver health care to those who need it, Green isn't afraid to use herself and her words as a vehicle to convey a message that she believes much of the country still has a hard time understanding. Give them treatment, she says, or they will die. She says, there are lots of things that can help people, but these things should be available to everybody. Green's family has understood this for a while. They have a foundation that's dedicated to improving global health and elevating socioeconomic conditions in impoverished countries. The Green Family Foundation, a private nonprofit organization, has worked with the Clinton Global Initiative in benefiting Haiti. Just recently, the foundation committed more than $280,000 to improving villages and restoring the country's musical heritage. The foundation also provided a $10 million gift to Florida International University to fund a community medicine program. Green, who spoke at the foundation's healthcare reform blogger roundtable in New York City recently, said her family's work has emboldened her to be aware of her environment and to not take life for granted. She has made a number of trips to Haiti, appearing with former President Clinton in photos and seeing the worst that poverty can bring. There she saw a woman whose breast was very much enlarged. She knew it was breast cancer, but she asked one of the doctors, what will happen to that woman? The doctor said, it will be cut off. She will die. This is a life without health insurance, she realized. And it was the kind of image that inspired her after her mother was diagnosed to get a mammogram. Her cancer was diagnosed soon after, and she underwent treatments. She sorted through options until she found what worked best for her. But when she thinks of the health care in the United States, she thinks of that woman. Costs are rising. Drugs are becoming less accessible. She's worried about how bad things can get. She wonders if we're not just one health crisis away from facing the same consequences. In the United States, at least, many people like Green have choices, but many do not. How long? Green asks, I don't know why it has to be this way.